So section 8, we have diseases of the mouth. So session overview. This session discusses the first set of conditions under the gastrointestinal system, that is disease of the mouth. And so the medical conditions affecting the mouth, such as stomatitis, gingivitis, thrush, viscera angina, among others, are discussed. And so at the end of the session, the students should be able to recognize common lesions of the oral mucosa from normal structures, identify treatment options available for conditions of the mouth, recognize the changes associated with the oral mucosa related to aging. And so the topics to be looked at include stomatitis, and then topic 2, we have the gingivitis. So stomatitis, let's look at it. So stomatitis is one of the most severe painful conditions of the oral mucosa from a variety of causes, and specific areas of the oral mucosa may be involved and then affected, and then can lead to systemic complications in the renal as well as cardiovascular and other systems. So general oral hygiene practices are imperative in its treatment as well as prevention. And so treatment usually is based on specific causative factors and use of general hygiene practices. And so in clinical sense, when we say stomatitis, it's about inflammation of the oral mucosa, and that looks at the buccal area. We also look at the labia, which is the lip, and then we also include the tongue, the gingiva, the palate, and then the floor of the mouth. And so here we have the stomatitis, and you can see that the tongue is affected. As you can see on the picture, the tongue is inflamed, and we have redness, and then even you can see that the mouth area, the lip, is also severely affected, and in between the areas that I have mentioned, we can also see some whitish exudates. These are all areas that are affected, and then we have some kind of pus around these areas. And the next picture also looks at similar case, and it shows stomatitis. And then the third picture also, you can see the tongue area, and then the oral mucosa is also affected. You can see the affected area here, where we have the hyperemic areas, redness, and then here we are talking about inflammation of the affected areas. And then here the tongue is mostly affected. We have the red areas, we have the white exudates covering the parts that are affected, and then we have the angular areas that are also affected in this case. And here too, you can see similar case, and it's telling us exactly what is happening. And then this picture also is telling us exactly what is happening. So etiology or causative factors or predisposing factors, this may include infection, infectious agents. For instance, streptococci, we have the gonococci, candida albicans, we have the coryn bacterium, diphtheria, and then we have the treponema pallidum. These are all the factors. And then we have other Mycobacterium tuberculosis and viruses like the viruses of the herpes simplex, which we have already looked at when we are looking at the what we call the viral conditions of the skin. And then we have the varicella zoster, measles, Coxsackie virus, and it may also result from erythematosus, particularly lack of vitamin B, and then the others, as we can see in vitamin C as well, in a case of pellagra situation, and then similar conditions, or from iron deficiency anemia with dysphagia related to glossitis and other oral manifestations. And then we have also mechanical trauma origin associated with the situations such as cheek biting. We have mouth breathing and ill-fitting dentures or nursing bottles with nipples that are hard or too long, which may produce characteristic manifestations. And D, we have generalized stomatitis, which may also follow excessive consumption of or use of alcohol, tobacco, hot foods, or spices. Others are associated with or linked to the sensitization to toothpaste, mouthwash, candy dyes, and then lipsticks. And E, we have drugs which may also cause it. Examples are phenytoin, anticonvulsant drugs, particularly useful in generalized seizures. And then we also have lead and then mercury toxicity, and many other drugs may also produce stomatitis. So chemicals, stomatitis of work-related origin may also be due to acid, mineral dust. And then G, we have the stomatitis, also common problem in cancer patients as a result of chemotherapy. For instance, doxorubicin, others, and then the radiation therapy, and then an inflammation response of the oral tissue that may progress from mild erythema to edema to painful oscillation, bleeding, and then the secondary infection. Clinical manifestations, we have itching, dryness, burning, and then the allergic stomatitis. And then we can also have intense shiny erythema with slight swelling. And then the allergic stomatitis may be also due to sensitivity to foods, lipsticks, and then the drugs. And then acute necrotizing ulcerative gingivitis causes osteonecrotic lesions of the interdental papillae that may also extend to the marginal gingiva and then produce painful ulcers of the mucous membrane. And then we have the candidiasis, which is thrush and is caused by Candidiasis albicans, and this is common in infants, immunosuppressed individuals receiving long-term antibiotics, and then anti-neoplastic therapy, and then those with xerothemia, dry mouth caused by insufficient secretion of saliva. And then this type of infection usually begins on the tongue, buccal cavity, and then they spread to the palate, and then gums, and then tonsils, and you can even spread to the pharynx, larynx, and the GI tract, and the respiratory tract as well. And the types, we have the pseudomembranous form, and then we have the chronic erythematous form. And then D, we have the membranous stomatitis, which is maybe associated with inflammation reaction, produces a membrane-like exudates, and they may be caused by chemical irritants like gold, iodides, and then bacteria such as streptococci, staphylococci, and then gonococci, and then even corynebacterium diphtheria. And then E, mucosal lesions accompany systemic diseases, and this is common in colic spots of measles and then painful mouth pellagra. And then the F, we have the Mccool cutaneous lymph node syndrome, and this affects children, causing erythema of the lips and oral mucosa. And then acrodina, which occurs in children and characterized by oral ulcerations, profuse salivation. And so assessment of the stomatitis, here we are looking at the grading based on assessment during examination through physical assessment and then health history. So we have stomatitis graded as grade 0, and here mucosa is moist, pink, and soft, no ulcerations or lesions, no discomfort in mouth. And so intervention is very simple. Instruct the patient to stop smoking and then reduce alcohol intake. And after each meal and bedtime, brush the teeth. And then grade 1, which is mild stomatitis, we have the whitish gingival area observable, or client mentions slight burning sensation, discomfort in oral cavity. And the intervention here is to provide normal saline rinse every 2 hours, brush teeth after meals and then bedtime, and then provide soft blunt diet. And then grade 2, which is a moderate stomatitis, there is moderate erythema or redness, and that is a sign of inflammation. And then here shallow ulcerations or white patches may be present, and then client may complain of pain but can continue to eat and then drink and then swallow. And the intervention here is very important. Provide normal saline rinse every 1 to 2 hours, and then brush teeth after meals and then at bedtime. And then topical anesthetics may be very important, but to be careful not to swallow the anesthetic agent because of the possibility of causing paralysis in the throat. And then provide a soft blunt diet, especially whole foods, and the dietitian can help plan meals to meet the patient, the nutrition needs of the patient. And then grade 3, which is severe. Here there is severe inflammation or erythema, and then full thickness ulceration has occurred, and the mucosa necrosis is also seen, and then white patches present, and the client complains of severe pain and is unable to eat, drink, and swallow. And probably here the patient may need hospitalization, and so interventions: rinse mouth with normal saline every 1 to 2 hours. Toothbrush may not be good because it causes bleeding. Gauze wrapped fingers is used to remove debris and then other substances, and then oral irrigation gently cleanses the mouth area, and then topical anesthetics and stomach analgesics may also be used to treat this condition. And tube feeding or parenteral nutrition may help the patient, and that is what I said, that the patient may be hospitalized. Diagnosis: establishing the cause may be very difficult. However, the history may disclose a systemic disease, and the history may also disclose a dietary deficiency, and may also disclose contact with irritants. And the physical examination is obligatory, since it may reveal lesions of the skin in a situation where we have pellagra, pemphigus, anemia, another contributory disease, or you can do direct smear and cultures from lesions which may disclose a specific pathogen, and then we can also do blood count to assess what is happening. We also have complications. We can have superimposed infections, and if we need to treat, other microorganisms may also enter the lesions. And then treatment for stomatitis addressed both the symptoms and then the cause. So underlying systemic disorder should be treated specifically, and the meticulous oral hygiene is always necessary, and then the candidiasis usually respond to nystatin oral suspension. And for instance, we have about 400,000 units 4 times for about 10 days as an oral rinse, and then swallow because of the possibility of affecting the GI. So nystatin can be continued at least 3 days after the symptom disappear. We can also use trimazole 10 milligrams oral lozenges 5 times a day for 14 days, and then other medications are also there. Mouthwash is very important. General nursing care. When caring for such a patient, client response to stomatitis, we have to look at that as well as coexisting condition, and then the client may also be suffering from either cancer, HIV, AIDS, other systemic illnesses, and undergoing treatment for these problems. Because of this, we provide client-focused nursing care based on assessment funding. So total client care is very important in such a situation. We also need to look at the nutritional problems, monitor the weight, and then diet in general is very important. And then they teach the patient and the family about the side effects, and then take the total control of the patients, and then the significant others in terms of diet. Gingivitis is similar to what we have done, and here inflammation of the gingiva characterized by swelling, redness, fluid exudates, and bleeding. Gingivitis is common and may be acute, chronic, and recurrent, and not common, not different from what we have done. We have food impaction, we have faulty dental restoration, and then we have mouth breathing as major causes of this kind of condition. Types: we have simple gingivitis, we have some gingivitis of diabetes origin associated with uncontrolled diabetes, we have gingivitis of leukemia, and then people with leukemia can also have it. Drugs-induced gingivitis, as we have already done when we were looking at the stomatitis. Phenytoin is a typical example. We have gingivitis associated with hypoventilominosis, like in pellagra and the others. So gingival abscess, and then prevention, daily removal of plaque with toothbrush is very important, and routine cleansing by dentists every 3 to 6 months is very also important. And conscientious mouth hygiene, restriction of amount of sugar in diet, and then vitamin C is believed to reduce gingivitis. And then treatment, we have in severe cases, parts from the gingival abscesses may be needed to for culture, and then appropriate antibiotics identified. Analgesics and anti-inflammatory medication may also be very important, and then vitamin C may be given to promote healing, and the mouthwash after each meal is also imperative. I want you to read on the following. So as your reading assignment, look at Vincent angina and then dental caries as major conditions also associated with the mouth. Thank you very much. Here are some references. You can take your time and then cross-check. Thank you very much.